name is Amanda, and today I will be performing the administration of the subcutaneous injection video, skills video for BSN 225. I have gathered all my supplies. I have my patient, gauze, my alcohol prep pads, gloves, my medication, my syringe. This is my hand sanitizer for now, as well as my sharps container. I'm currently traveling, so I don't have all of my things, so I apologize. So now that I've go ahead and verified or gathered all my supplies and my patients, I'll make sure that I have my needle here. That's about, it's a 25 gauge by 5 by 8 inch, and a 1 millimeter syringe. So I have this right here. And then my vial of heparin, it is about 10,000 units with 10 milliliters. And before I start anything, I go ahead and verify my provider's orders in the EHR and verify the 6 rights of medication, which is the right patient, the right time, right dose, right route, right documentation, and right medication. Once I have all those, I'll go ahead and compare everything with the EHR and the MR, and as well as confirm the provider's orders and administer actually 1,000 units of heparin per day. That's what the provider's order says. And I'll go ahead and confirm that I have the correct vial, which I already did, and I calculated the dosage for the heparin for the patient, and it needs about 1 milliliter, so that's about 1,000 units that I'll be administering of heparin to the patient. And then once we've verified all of that, I will gather my supplies, go in the patient's room, knock, 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 introduce myself, let them know that I'll be their nurse today, and close the door for patient privacy or the curtain, and go ahead and ask them to, after I introduce myself, let them know what I'm doing today, let them know that I'll be their nurse and my name's Amanda. I'll ask them to verify their first and last name and date of birth, and I'll go ahead and check their wristband as well. And then I also ask them if they have any allergies, and they say no, which is great. And then I'll go ahead and start preparing the medication. Just let them know, hi, your doctor has ordered heparin today as an injection, and I'll go ahead and perform hand hygiene. Go ahead and do that, and explain the medication. Let them know that this is a heparin injection and it's used as a blood thinner, and it actually prevents blood clots from forming in your blood vessels. And common side effects that can happen are easy bruising and increase of bleeding, and increase of bleeding just in case if you get a cut or a scrape, just in the next time or after that. And just normally with injections, you can feel some burning and stinging, but that should resolve very quickly. And so perform hand hygiene there. Go ahead and put my gloves on here. Okay, great. Okay, so next I'll get my alcohol pad here and just clean the top of medication here, throw that away. And then next I will go ahead and open up my syringe, which is 25 gauge, 5 by 8 inch, about 1 milliliter to draw up. So I'll go ahead and open that up here. Okay, and then I'll go ahead and take the cap off, and I will do about, 1 milliliter. There we go. So I have 1 milliliter of air, and clearly it's a 1 milliliter syringe, so I'm all the way at the end. So next I will go ahead and draw up the air here. We'll go ahead and poke the syringe here. Oh, kind of holding my hand like a dart. There we go. Go ahead and put that in. Flip it upside down. Go ahead and withdraw 1 milliliter. And if you do get bubbles, go ahead and tap them out here. Don't see that we have any bubbles there. So it looks good. And go ahead and pull that out. Pull the cap over. I'll go ahead and show the camera my dose. Try my best. It's about 1 milliliter there. I'll hold it there for a second so you can go ahead and see. I tapped out any bubbles. I verified the correct site. Usually for subcutaneous injections, you will need the lower abdomen, the back of your arm, or the upper thigh. And in this case, we're going to go ahead and do the lower abdomen. And I will go ahead and do the 1 scoop here. And close it because I need to go ahead and prepare the injection site. So I'll go ahead and make sure it's clean. I'll wipe about 5 inches around. Great. Go ahead and let that air dry. Do not blow on it or use your hands to do all that. Okay. So now that the skin's all prepared, I can go ahead and prepare the injection. So because it's a heparin injection, I will need to pinch it. So I'll go ahead and get this going. Go ahead and open that. So I'll pinch and measure the needle and make sure I stick it either a 45-degree angle or a 90-degree angle. So I'll pinch the skin once it's all dry. It looks all dry here. And go ahead and prepare it. Here we go. So let me pinch the skin. Poked it here. Go ahead and prepare everything. There it goes. Great. Awesome. And before I did that, I went ahead and verified that my patient's skin looks good. There's no discoloration, no inflammation, and the skin's okay and not tendered. I palpated it as well. And looks like the site's okay. And this is my sharps container, so just sticking that there. Everything looks good with my patient. I can go ahead and talk to them for a little bit just to make sure they're okay after the injection. I know some people can get common reactions, and I will ask them to let me know if those common or adverse reactions happen because I need to know immediately. And then next I will go ahead and clean up my site. I will document everything. I will make sure that I'm doing I did the right dose at the right time, the right medication, right patient, right documentation, and right route as well. And I'll leave the patient's call light, making sure they're okay, thank them, also ask if they have any questions, and I will go ahead and clean everything up and throw it in the trash. Thank you.